Good day everyone, my name is Maria Evanel R. Noveno from BSN 21 PLM College of Nursing, and today I will be showing you how to assess the vital signs of a newborn. But first of all, what are vital signs and why do we need to take them? Vital signs consist of taking the newborn's respiratory rate, heart rate, and auxiliary temperature, and we need to take them to determine if the baby is transitioning well into their extrauterine environment, and it also helps us determine the functioning and rhythm of their essential organs. But we need to remember that taking the vital signs should be done between feedings and start with the non-invasive assessments first, such as the respiratory rate, to avoid disturbing the baby. Because once the baby cries, it will compromise the procedure and it would lead to inaccurate measurements. So now that we know what vital signs are and its purpose, let's move on with the procedure. First, we need to prepare and gather the equipment and materials that we will be using for this assessment, and that includes the watch with the second hand for counting, the infant stethoscope for auscultation, the digital thermometer for temperature taking, the cotton balls, the tray and receptacle, the gloves, and the 70% isopropyl alcohol solution. So this is done to save time and effort and to ensure that the procedure will be organized and efficient. Next, we need to perform proper hand hygiene, wear PPE and gloves if indicated. So this is done because performing proper hand hygiene is the most effective way to prevent the spread of microorganisms and cross-contamination. It can be done using antiseptic hand drops, alcohol-based products, hand washing with soap and water, and surgical hand antisepsis. Okay, so for this assessment, we will be using the alcohol. Then we should wear gloves to prevent contact with body fluids such as blood. But for this assessment, let's just assume that I'm wearing gloves. Next, we need to wear PPE if indicated for transmission precautions, especially now during the pandemic. Then we need to make sure that all the equipment and materials that we will be using for this assessment is cleaned and sanitized to prevent the spread of microorganisms and cross-contaminations. Okay, so for this assessment, I will be cleaning the digital thermometer using a cotton ball and alcohol. Okay, so we should start from the tip to the bottom using circular motion. Then we need to properly dispose the cotton ball that we used in the proper receptacle. Then we also need to clean the stethoscope that we will be using for auscultation using a cotton ball and alcohol. Okay, so let's start with the earpieces first. Then down to the tubes. Then we also need to include cleaning the surfaces of the diaphragm and the bell. Then we need to properly dispose the cotton ball that we used. Okay, so after making sure that everything is cleaned and sanitized, we can now position the newborn on her side with her head slightly lower than the rest of her body. So this allows the nurse to visualize the area necessary for assessment, and this also stimulates crying. Okay, so let's turn the baby gently on her side and lift the lower half of her body. Okay. Then, if the baby cries, we need to note and record their first cry because this determines the baby's ability to breathe well, also their lung patency and lung capacity. Okay, so after the baby cries, we need to turn the baby gently on their supine position. Then, we need to note and record their cry for accurate documentation, continuous communication, and interpretation of findings. Okay, after that, we can now assess the respiratory rate of the newborn every 15 minutes for 1 hour because an increasing respiratory rate is a sign of respiratory distress. But first, we need to observe the abdominal movement of the newborn because an infant's breathing primarily involves the abdomen and diaphragm muscles. Okay, so I can see no retractions wherein the ribs of the newborn becomes evident when they breathe. And I can also see no nasal flaring. And if both of those are present, then that could indicate that the baby is having respiratory distress. Okay, so after the observation, we can now palpate and count the rise and fall of the abdomen and diaphragm muscles for 1 full minute, because one respiration is composed of 1 inspiration and 1 expiration. And counting for 1 full minute increases the accuracy of the respiratory rate measurement. Okay, so now I will be placing the pads of my fingertips on the newborn's abdomen. Then I will observe the rate, rhythm, depth, and character of respiration of the newborn for 1 full minute. So the normal respiratory rate of a newborn immediately after birth is 80 breaths per minute, but after a few minutes it will stabilize to 30 to 60 breaths per minute. And we also need to remember that the normal rhythm, depth, and character of a newborn's respiration is irregular, abdominal, gentle, quiet, rapid, but shallow. We also need to remember that newborns are nasal breathers, so if their nose is obstructed, then they will show signs of respiratory distress. And if they have tachypnea or abnormally rapid breathing, then that could be related to sepsis, hypothermia, hypoglycemia, and respiratory distress syndrome. Then, if the baby coughs, sneezes, or cries during the assessment, then it should be repeated. But we need to remember that coughing and sneezing reflexes are present at birth and are normal because it is their way of clearing their airway secretions. But if it disrupts the measurement, then it should be repeated. Okay, so after counting for 1 full minute, we can now document the rate, rhythm, depth, and character of respiration of the newborn for accurate documentation, continuous communication, and interpretation of findings. So the respiratory rate of the newborn after 1 full minute is 38 breaths per minute, and the rhythm, depth, and character of respiration is irregular, gentle, quiet, rapid, but shallow. Then we need to report for any sign of increase in rate, retractions, nasal flaring, grunting, and respiratory signs of distress, and also cyanosis, because that could indicate that the baby is having a hard time breathing, which could lead to complications or death. Okay? After that, we need now to auscultate for breath sounds. Okay, so for this assessment, we will be using an infant stethoscope. So let's assume that this is an infant stethoscope. Okay, so listening to the bilateral breath sounds should be done from the bottom or base of the lungs to the top or apex of the lungs, with the infant lying on her back. Okay, so this is essential because respiratory sounds provide vital data about the pathology, physiology, patency, and capacity of the lungs. And examples of abnormal breath sounds include wheezes, crackles, stridor, raunchy, and grunting, and if any of those are present, then the baby could be having respiratory distress. Okay? So I will now be placing my infant stethoscope first on the left lower lobe, then to the right lower lobe, then to the right middle lobe, then to the right upper lobe, which can be found just slightly above the clavicle, then to the left upper lobe. Okay, so I can hear no abnormal breath sounds, which is the ideal result for this portion of the assessment. Okay, so we need to record that for accurate documentation, continuous communication, and interpretation of findings. Okay, after that, we can now assess the apical heart rate of the newborn every 15 minutes for 1 hour to determine the heart function of the newborn. So first, we need to place the stethoscope over the border of the left sternum, where the apex of the heart can be found, which is where the heartbeat can be best heard. Okay, so the apical pulse of the newborn is located at the point of the maximal impulse, which can be found lateral to the midclavicular of the left lower sternal border of the fourth intercostal space. So to find that, first we need to find the clavicle, then the sternum or the breastbone, then the fourth intercostal space. So we need to count 1, 2, 3, and 4. And we need to remember that it is lateral to the midclavicular. So we need to move to the left, and that is slightly below the nipple of the newborn. So we will be placing the stethoscope just slightly below the nipple of the newborn. Okay. Then I will count the heart rate for 1 full minute. So counting for 1 full minute increases the accuracy of the measurement. So the normal heart rate of a newborn immediately after birth is 180 beats per minute. But after a few minutes, it will stabilize to 120 to 160 beats per minute. Okay, and we also need to remember that crying increases the heart rate and sleeping decreases the heart rate. Okay, so after counting for 1 full minute, we can now document the heart rate and rhythm of the newborn for accurate documentation, continuous communication, and interpretation of findings. So the newborn's heart rate is 138 beats per minute and it is regular. Then we need to make sure to listen to heart murmurs and irregular heart rates, but we need to remember that irregular heart rates are normal because the cardioregulatory center at the medulla of the brain is still immature. But we need to reassess and evaluate further because it could be due to congenital heart defects such as coarctation of the aorta and incomplete closure of the fetal circulation shunt. Okay, and if we find any abnormal findings, then we should report it to avoid complications or worse, death. Okay, so I can hear no abnormal heart rates or irregular heart rates and heart murmurs. Okay, so after that, we can now monitor the axillary temperature of the newborn because newborns are very susceptible to heat loss because they lack the shivering mechanism, they lack the adipose tissue to insulate them, they are wet at birth due to the amniotic fluid, and the delivery room is cold. Okay? So for this assessment, we will be using the digital thermometer and we need to place it into the axillary of the newborn. Okay, so the axillary temperature is actually preferred due to the risk to tissue trauma, perforation, and cross-contamination related to the rectal temperature. And this is also one of the simplest, most convenient, and accurate methods of measuring the temperature. Okay, then we need to secure the digital thermometer on the infant's axilla by holding the infant's arm firmly against their side. Okay, so this also increases the accuracy of the temperature measurement. Then we need to wait for the beeping sound of the thermometer before reading the results because that also increases the accuracy of the measurement of the newborn's temperature. So the average or normal temperature of a newborn is 36.5 to 37.2 degrees Celsius. Okay, so that's the beeping sound. So the newborn's temperature is 36.6 and we need to document that for accurate documentation, continuous communication, and interpretation of findings. Okay, after that, we can now keep the newborn warm by wrapping them safely in a blanket and placing a cap over their head. Okay, so that is done to prevent infection and hypothermia. This is also done to prevent hypoglycemia because newborns use glucose for heat production when they are cold. Okay, so let's remove the blanket of the newborn. And to swaddle or mummify the newborn, we will be using the parent wrap method for this assessment. Okay, so assuming this is the muslin cloth, first we need to secure the newborn's arm firmly against their side and pull one corner of the muslin cloth across their body and tuck it firmly beneath them. So first, we need to turn the baby gently on her side so that we can tuck the blanket firmly beneath her. Then we need to repeat the procedure on the other side. So first, we need to secure the newborn's arm firmly against their side and pull the other corner across their body and tuck it firmly beneath her body. Okay, so again, we need to turn the baby gently on her side. Then we need to pull the bottom of the blanket over her body. And tuck the sides again firmly beneath her. So again, we will be turning the baby gently on her side. Then the other side. Okay, so now that the newborn is wrapped firmly in a blanket, we can now place the cap or bonnet over their head. So assuming this is a bonnet, we need to place it over the newborn's head to provide warmth for their head. Okay, so now that the newborn is wrapped safely in a blanket with a cap over their head, we can now maintain uninterrupted skin-to-skin contact with the mother to promote bonding, initiate breastfeeding, and provide warmth for the baby. After that, we need to perform proper hand hygiene and clean all the materials that we need or we used to prevent the spread of microorganisms and cross-contamination. And that is all for the assessments of the vital signs of a newborn. Again, my name is Maria Evanel R. Noveno. Thank you for watching.